and another busy week for New York City. A visit from the next governor and the first week of the new vaccine mandate. We want to get right to our On the Record segment this morning with New York City Health Commissioner Dr. Dave Chokshi. Busy week here. Doctor, thank you so much for being here on Picks on Politics.
Of course. Good morning, Dan. Thanks for having me.
Good morning. So I want to talk about the first week of the vaccination mandate, right? Do you think the key to NYC program is actually making a difference in fighting the Delta variant, getting people vaccinated? I know you have some numbers here.
Yes, I do. We know that vaccination is the most important tool that we have to fight back against the Delta variant. And that's why we've taken it so seriously in terms of lowering barriers to access, providing incentives, and now moving to requirements where they are needed to improve vaccination rates. And it's showing up in the numbers. We're now at 2 consecutive weeks of over 100,000 first or single doses administered in New York City. And that's great news. We have 75% of all New York City adults with at least 1 dose. So we want to keep going, but this is great progress. And it's much needed to fight the Delta variant.
Yeah, so there's a lot of fear over the Delta variant, right? And we're seeing cases go up, hospitalizations go up, deaths in the state actually going up. So the number's not trending in the right direction here. Let me break this down into 2 questions for you. What can the unvaccinated do to help fight this? Because I think that's a big question. And then what can the vaccinated do to fight this?
Thanks. I appreciate the way you broke it down. And again, I'll ground us in the data. I am concerned about the Delta variant, which constitutes over 97% of the cases that we're sequencing in New York City now. And we're at about 2,000 cases per day across the 5 boroughs. And the Delta variant is driving, a lot of that increase. At this stage in the pandemic, I really think of us as having 3 major categories of interventions to address the coronavirus. The first is getting as many unvaccinated people vaccinated as possible. And that gets to what we just talked about.
Yeah.
The second is to ensure that unvaccinated people are taking the precautions that we know have worked earlier in the pandemic: masking, distancing, getting tested, ventilation, hand washing. And then the third is for even fully vaccinated people to take some of those precautions as well. For example, wearing masks in public indoor settings, keeping your hands clean, staying home if you're feeling ill.
Yeah, and when I asked the question about vaccinated people, I think things have changed, right? If I'm vaccinated and I come down with COVID from a breakthrough case, do I still have to quarantine as I did if I weren't vaccinated?
This is an important question. And the short answer is it depends on if you're feeling symptoms or not. If you are fully vaccinated and you've been exposed to someone who has COVID, you don't need to quarantine unless you are feeling symptoms, in which case you should quarantine and get tested immediately, because we are seeing that the numbers of breakthrough cases have increased in the context of the Delta variant compared to earlier. But there's one important point that I want to make about this, which is that some things have not changed. We know that all of the authorized vaccines continue to offer strong protection against severe illness. And there's recent data out from New York State, which showed that all of the vaccines taken together are still over 90% effective at preventing hospitalization.
And that brings me to the next
topic.
topic.
I care about, really trying to prevent those severe outcomes.
Yeah, absolutely. And that actually brings me to the next question, Commissioner, because all of this talk is coming as the CDC announced this week that 8 months after getting Pfizer or Moderna, the Biden administration wants to look at people recommending getting them a booster shot. How will the rollout of that look in New York City? How would you monitor if someone actually gets a booster?
We'll be ready for this in New York City, and we do have ways of monitoring booster doses in our citywide immunization registry. But Dan, let's take first things first. When it comes to vaccination, the most important thing is to get as many people their first doses as possible. After that, we need to make sure that people who are getting one of the 2-dose vaccines come back for their second dose. In New York City, about 95% of people are, and that's good news because we know that both doses are needed for the best protection against Delta. And then the additional doses beyond that, right now, the people whom we're recommending are people who are significantly immunocompromised. This means if you've had a kidney transplant, if you've had cancer and you're on chemotherapy, those are the people that we're prioritizing for additional doses now,
Commissioner,
and then planning for the boosters in September.
Simply almost out of time here, but I want to get to schools right now because there's big news that broke in terms of public schools. If you're playing a PSAL sport, you're going to have to be vaccinated, right? Why that decision, and where are we at with remote learning?
Yes, for higher risk sports, we are requiring vaccination, and that's because of the science. We know that in the closer contact in football and rugby and other sports, it's important to keep our kids safe. And so that's why we're promulgating this new vaccine requirement, which I strongly support. With respect to the first day of school and how we're thinking about it, we're going to bring to bear all of these interventions, particularly vaccination, and very much prioritize in-person learning. As a doctor, as a father, this is so important to me to get as many kids learning, in classrooms with their teachers, because that has social benefits. It has, of course, educational benefits, but it has health benefits as well.
Understood. We're out of time here. And just briefly, if you can, in 10 seconds or less here, do you have any indication of a timeline for those under the age of 12?
We expect that Pfizer will submit their data to the FDA in September. I think, November, maybe December is the earliest that we would actually be administering it to children under 12. I'm very much anticipating that as well.
Health Commissioner Dr. Dave Chokshi, thank you for your first appearance right here on Picks of Politics. There'll be many more to come. Appreciate it.
I appreciate it. Thank you, Dan.